Hi, my name is Corinne Carey. I'm the campaign director for Compassion and Choices in New York. Welcome to this webinar where we will talk about how to get you ready for our Spring Lobby Day in Albany on May 9th. You can stop and start this recording at your leisure. Hopefully you can listen and view the entirety of it before May 9th. And if you have any questions, there's contact information at the end of this webinar so that you can ask those questions via email or give one of us a phone call. This training will last just over an hour. I'm going to skip over some of the details on the slides. I won't be reading everything on the slides. And again, if you have any questions, you can ask them after. So at the end of this presentation, there will be a section on tips for meeting leaders. So if you're not planning on being a meeting leader or you're not interested in learning that role, then you can certainly end the training right before that session starts. So again, we'll go just a little over an hour and let's get started. On our agenda today is a discussion about compassion and choices and who we are as an organization in case lawmakers or others ask you who you're lobbying with in Albany on May 9th. Next, we'll go over New York's aid in dying legislation and where we are with the bill in the legislature now. We'll talk about the basics of lobbying, what you'll need to know for May 9th about lobbying your lawmakers, but also how to lobby in your home district if you can't come on May 9th or you plan on following up with lawmakers after May 9th in their home districts. The next section is how to talk to lawmakers about aid in dying. What language do we use? What are some of the talking points that we use when discussing this issue? The next section focuses on frequently asked questions about the Medical Aid in Dying Act and how to respond to them. We'll then turn our attention to May 9th in Albany, what to expect that day, where to meet, what the agenda of events is, etc. And then finally, as I said, we'll go over some tips for meeting leaders. So again, if that's not something that you're interested in, you can end the webinar at that point and get on with your day. So Compassion and Choices is the nation's oldest, largest, and most active nonprofit organization working to improve care and expand choice at the end of life. Across the nation, we work to ensure healthcare providers honor and enable patients' decisions about their care. At Compassion and Choices, we work to empower people with information and tools, including our free consultation program, to receive health care that's consistent with their values and priorities as they approach the end of life. We advance policies that allow people to make fully informed decisions about their health care, such as improving hospice and palliative care and ending unwanted medical treatment. We also authorize and implement medical aid in dying to allow mentally capable adults in their final weeks or months of a terminal disease to advance the time of death and end unbearable suffering. In our legislative advocacy program, we help to draft model legislation that authorizes medical aid in dying. We assemble and coordinate legislative testimony. We conduct public education and engage in community organizing. We sponsor legislative advocacy days, like our Lobby Day in Albany on May 9th. And we help to coordinate in-district lobby visits so people who support medical aid in dying can meet with their lawmakers in their own communities. So what is aid in dying? Medical aid in dying is a safe and trusted medical practice in which a terminally ill, mentally capable person who has a prognosis of 6 months or less to live has the option to request from their doctor a prescription for medication which he or she can choose to self-ingest to end unbearable suffering and to die peacefully. The practice is also known as death with dignity. Let's take a look at where states authorize medical aid in dying. Oregon was the first state in the United States to authorize medical aid in dying by ballot initiative in 1994. The next state to follow was Washington in 2008, also by ballot initiative. In Montana, in that same year, that state's Supreme Court issued a ruling that authorized medical aid in dying. And in 2013, Vermont became the first state legislature to authorize aid in dying through the legislative process. In 2015, California authorized the practice through legislation as well. And in November 2016, Colorado authorized the practice by ballot initiative. Also, at the end of last year, the District of Columbia's Death with Dignity Act, passed by the DC City Council and signed by the mayor, went into effect on February 17, 2017. So we now have 6 states and one jurisdiction that authorize medical aid in dying in the US. All of these laws are based on Oregon's model. As I said, Oregon passed its Death with Dignity law through a public referendum in 1994. It says it was passed here in 1997. It actually went into effect in 1997 after several court challenges to the law. And since 1997, a total of 1,749 people in Oregon have received a prescription for aid in dying medication. And 1,127 people have died after ingesting the medication, which means that approximately 36% never ingested the medication they received. Their families report that they achieved significant peace of mind just knowing that the medication was there should they need it. 102 physicians wrote 204 prescriptions in 2016, with no doctor exceeding 25 prescriptions during the year. This number of physicians who participate in Oregon's Death with Dignity program has been growing. As demand for medical aid in dying and the conversations around the option of medical aid in dying increase, more and more doctors are attending trainings and becoming comfortable with the idea of responding to patient requests. In 2016, there were 133 deaths under Oregon's Death with Dignity law as compared to 135 in 2015. So the number has held steady over the past few years. Close to 90% overall have been able to die at home, with the number holding at 88.6% in 2016. And close to 90% were enrolled in hospice at the time of their request and ingesting the medication. Under Oregon's Death with Dignity Act, end-of-life care has improved in Oregon for everyone. That state has seen a 30% increase in referrals to hospice care. More doctors are taking continuing education classes to improve end-of-life care. More of those doctors are willing to increase morphine dosages to control pain, and most of these doctors felt better equipped at pain management. There's a national group called the Center to Advance Palliative Care, and each year they do a study to determine how well hospitals are doing in terms of delivery of palliative care. And in the states where aid in dying has been authorized at the time of the report, those states received an A. The center gave New York a B with 79 or 78.1 points. I think that we can do better than 78.1 points out of 100. I think we can make New York a state where we have excellent delivery of palliative care. And in what we've seen from these other states is that once medical aid in dying is passed, that kind of care gets better overall. Let's turn for a moment to New York's legislation and talk about what the bill would do. But first, some of you may recognize this little guy. Back in the 70s, there was a Schoolhouse Rock series on how a bill becomes a law. And even though that was a sort of simplified version of the convoluted process that legislation goes through at the federal level, it is important to know a little bit about how laws get passed at the state level, which is different in New York than it is at the federal level. So let's take a moment to go over how a bill becomes a law in New York State. It starts with an idea. Step number 1 is an idea. The idea for a bill can come from several sources: lawmakers and their staffs, the governor or his staff, or departments like the Department of Health, individuals, lobbyists, and interest groups, Or it could be a bill from a previous session that failed to become a law. Step number 2 is getting a sponsor. A bill must have a sponsor in order to be introduced. Lawmakers, the governor, and the attorney general can sponsor legislation. When the idea for a bill originates outside of these parties, though, a sponsor has to be found. For example, a lobbyist with an idea for a bill has to circulate it among legislators in order to find a sponsor. In the case of the Medical Aid in Dying Act, Senator Diane Savino was moved by the story of Brittany Menard, the young woman from California who moved to Oregon to access medical aid in dying. When she shared her story with the world, the legislature in California responded by passing the bill, and lawmakers from all over the country introduced legislation in 25 states. So that was the impetus for Senator Diane Savino, who carries our bill now. Assemblymember Amy Paulin was motivated by the death of her sister and has spoken about this publicly. So we have 2 highly motivated lawmakers who carry our bill. They introduced that bill as it currently exists last year on May 10th on our lobby day. So the bill has been introduced, and the next step is committee action. Bills in New York have to go through a series of committees based on the subject matter that they deal with. And in this case, the Medical Aid in Dying Act has to go through the Assembly Health Committee, the Assembly Codes Committee, the Senate Health Committee, and the Senate Codes Committee. The bill can originate in either house. It can move through these committees in a parallel way at the same time in the Assembly or the Senate. It just so happens that our bill is moving through the Assembly now, and right now the bill is before the Assembly Health Committee. Once it passes the Health Committee, it then goes on to codes, and at any point the Senate committees could take up the bill. During this process, there may be lawmakers and stakeholders who have concerns about different provisions in the bill or technical changes that they'd like to see. So during the time that the committees are contemplating the bill, we've seen the bill amended once. This may happen again during the process of committee review. Once the bill passes through the requisite committees, it then heads to the Assembly floor and the Senate floor for a vote. In New York, bills have to be what they call the same as. They have to be exactly the same as passed by the Assembly and by the Senate. Once you have a bill that matches, that has passed through both of those chambers, then we move on to step 7, which is the governor. And the governor can sign the bill, he can veto the bill, or he could let the bill become law through inaction. And we won't go through the details of that today, but just know that the second to last step here is the governor's action. And then step 8, the bill becomes a law. So that, in short, is the legislative process in New York State. Let's turn back to New York's Medical Aid in Dying Act. As I mentioned, it was introduced on May 10th of 2016, and it was reintroduced this year in January as Senate Bill 3151, Assembly Bill 2383. The bill is sponsored by Senator Diane Savino and Assemblymember Amy Paulin. It passed the Assembly Health Committee last year on the 23rd of May. New York has a 2-year legislative cycle, though. A new 2-year cycle started in January 2017, so the bill needs to pass the Assembly Health Committee again before moving through the rest of the committees. So each 2-year cycle, it doesn't matter what happened in the past, you have to start all over again. So we're starting all over again with the bill in the Assembly Health Committee. The New York legislation does the following. The Medical Aid in Dying Act would allow a terminally ill, mentally capable adult to request life-ending medication from a doctor that the person can take at a time of his or her choosing, or never to bring about death, so long as he or she can self-administer it. Those are the key provisions of the Medical Aid in Dying Act. But the bill also contains a number of safeguards which mirror those that we find in Oregon and the other states in the US that have authorized medical aid in dying. and I'll go over these now. But just know this is a summary of the safeguards that are included in the bill. If you want to look at the entire bill and read it for yourself, you can always look it up on the Assembly website or the Senate website using the bill numbers. The terminal illness and 6-month prognosis have to be confirmed by 2 doctors. If either doctor has concerns about the patient's capacity to make an informed decision, they have to make a referral to a mental health professional, and medication can't be prescribed until capacity is determined. 2 people must witness the written request, one of whom can't be someone who stands to benefit from the estate. And neither the doctor nor the professional who may provide a competency determination can witness. A prescribing doctor has to comply with extensive medical record documentation requirements and make records available to the Department of Health. Immunity from civil and criminal penalties and professional malpractice is provided for those who comply with all aspects of the law. And on the flip side, criminal law prosecution is still available for those who violate the law. Life insurance payments can't be denied to the families of those who use the law. Significantly, no physician or facility can be required to participate, and no patient can be coerced or forced to choose aid in dying. Unused medication must be disposed of according to the Department of Health guidelines, and the Department of Health is required to issue publicly available annual reports on the utilization of medical aid in dying. So those are the safeguards. Let's turn now to the basics of lobbying and what you'll need to know, both for May 9th and for any in-district visits that you might want to have with your lawmaker. I've broken down lobbying in 10 easy steps. Some of these steps have already been taken care of for you for May 9th, but we'll go over each one so that you have a sense of how the whole thing works in one big picture. But first, let me tell you about CNC New York's rating system. Each lawmaker falls on a spectrum of how they feel about medical aid in dying. And in order to figure out how we approach lawmakers for a second, third, sometimes a fourth meeting, it's helpful for us to know where they stand. And so we give the designation of a 1 to lawmakers who are current sponsors of the bill. We designate with a 2 lawmakers who support medical aid in dying, but they are not yet a sponsor. We give folks a 3 if they have questions or concerns about medical aid in dying, but they're leaning towards yes. We rate them a 4 if they have questions or concerns, or if they're leaning no. For those that are given the designation of 5, they're not supportive of medical aid in dying. And those who we designate as a 6 are not supportive, and we expect them to be an outspoken opponent. The information that you provide with us to provide us after the lobby day will help us determine where each lawmaker stands on the spectrum. The first step in lobbying is to get organized. You have to figure out who your target is and what your target's position is. CNC can help with this. If you are thinking about meeting with a lawmaker in your home district and you want to know where they stand, certainly get in touch with us and we will have information from past visits and lobby days to draw on to give you a sense of where the lawmaker stands. You should then figure out what issues are important to your target. You can do a Google search for statements made by the lawmaker on this topic. If you know you're going to be meeting with a legislative staff member, don't skip this step because there are many legislative staff members who are active in their own communities and speak out about issues. Once you know these things, you can figure out who your target needs to hear from. Are they most concerned about their constituents? Do arguments of faith and arguments from clergy members make a difference to them? Do they need to hear from a healthcare professional or someone with a story about aid in dying or about a painful death? All of these things should be done in advance of setting up a meeting. The second step is actually asking for a meeting. On May 9th, we're working really hard to have all of your meetings scheduled. We have requested meetings with your assembly member and your senator, and we'll be slotting you into meetings with other lawmakers if possible that day. But here are some tips for scheduling an in-district meeting on your own after Lobby Day. The first thing you want to do is check online at the 2017 legislative session calendar to see which days they're in Albany and which days they're in their home districts. The blank dates on the calendar that you see here indicate the dates that they're not in Albany. You want to pick 3 times that are convenient for you and your team and start trying to schedule early by calling the district office. Make sure that you have the bill number and the name of the bill handy when you call. The person scheduling the meeting in the district office will want to know what you're coming in to meet about. And then once you've confirmed a date with the lawmaker, confirm that date with your team and make sure that everyone's available to go. The next step is assembling your team and assigning roles. On Lobby Day, it'll be pretty easy. You'll be grouped in with a facilitator or a lobby leader and other constituents from that lawmaker's district. There may be people who have stories to tell. There may just be concerned voters on your team, but the facilitator will know how to handle the meeting no matter who attends. Everyone has a part to play in a lobby meeting, even if you don't have much to say at all. There are those who lead the meeting. There are people who tell their own stories. There are people who can provide facts and statistics and talk about Oregon's evidence. And many times the facilitator or the leader is that person. You want to think about who you want to bring with you. As I said, through your research, you'll know whether a constituent, a clergy member, a healthcare professional, a family member, or someone who might want to use the law should come with you. Sometimes you even have to think about who shouldn't come. If you know of a supporter who has extreme views on medical aid and dying, or whose views really fall outside the scope of what the safeguards of the bill are, or someone who could tend to be hostile, you might not want to bring that person to an in-district visit. So think carefully about your team. You also want to schedule a prep meeting with your team ahead of time. When we've done in-district visits throughout the state, we generally jump on the phone for an hour. We get to know each other a little bit and we assign roles and figure out the order of speaking. It makes the meeting so much more organized when you're able to do that ahead of time. Just a note here about the power of storytelling. As I mentioned, Brittany Menard shared her story with the world and really changed the dialogue around medical aid and dying. She moved lawmakers across the country to sponsor legislation that would authorize medical aid and dying, but she also inspired other terminally ill people to share their stories. Personal stories speak to people's hearts and to their shared values. They ground policy in real life. Talking about real people humanizes the information. And stories help people understand. It's easier for people to grasp the concepts and retain the information about key provisions of a bill when it's tied to a real person's experience. And stories depoliticize the issue. This is about someone, like the person you're engaging, who'll be helped by changes to the law. Stories open doors. In areas where it's difficult to discuss the law or the reform effort, sharing a simple story is a way to open a dialogue. People don't remember facts and figures, but they do remember stories. The fourth step is planning your arrival. You want to research travel from point A to point B. You want to show up on time and be patient because sometimes lawmakers are on a different schedule than you are. On May 9th, all of the meetings are going to be in the Legislative Office Building or in the state capitol, so it's pretty easy to figure out point A to point B. You want to check your meeting room and make sure that you leave 10 minutes to get from one meeting to another. Lobby days on Tuesdays in Albany are incredibly crowded, and at this point in the session, there are going to be a lot of people there. If you leave the security area for any reason, to go outside and get a breath of fresh air or to go and get something to eat outside of security, you want to tack on at least 10 to 15 minutes of travel time because the lines to get back through security are long. I want to make sure that you're not discouraged if you meet with staff. We are making every effort to make sure that people get in front of lawmakers one-on-one this year. But if it so happens that you have to take a meeting with the staff, just know that staff are charged with bringing back all of this information to the lawmaker. And sometimes the staff is even more knowledgeable about the bill than the lawmaker is. So don't be discouraged, although we are trying to get meetings in person with all of you for your lawmakers that day. I'm just going to put this here because it's about planning your arrival. A note about parking. Some lawmakers are in, when you're meeting with them in district, are in a building that has difficult access to parking. You always want to pay attention to parking, and particularly in Albany, but we'll get to that when we talk about planning for May 9th. Step number 5 is dressing the part. Hopefully you've indicated to us what size t-shirt we should bring for you, because it makes a huge impact for lawmakers to see all of us in our bright yellow garb walking and moving through the hallways in Albany. Last year, our supporters didn't hesitate. They planned well, and they were able to put a Compassion and Choices yellow t-shirt over what they were wearing. And as I said, it really made a big deal. And you can identify yourself to other supporters that way as well. So make sure you either, wear something that you can pop a t-shirt on over, or wear something yellow with some blue accents so that you can be part of our group. Also, wear comfortable shoes. Some of you have expressed the fact that it would be difficult for you to move around a lot in the Capitol, and I don't want to discourage anyone from attending. If you can come to the press conference and make it to one meeting, we need you in Albany. We're not going to make you walk around all over the place. But for those of you who want to run back and forth between the Legislative Office Building and the Capitol and attend all of the activities that day, make sure you wear comfortable shoes. Some supporters have taken to bringing a picture of their loved one and or a handmade sign. These pictures are incredibly effective in lobby visits, and they look fantastic when the press captures them as well. So last year, Stacy Gibson, our action team leader in the Lower Hudson Valley, made these signs for her and her friends to wear in memory of her husband, Sid, who died a very painful death. And I can tell you it had quite an effect on the lawmakers that we went and met with. The next step is to develop a meeting agenda, and these are the points that are usually covered in every meeting with lawmakers. The facilitator or the leader wants to thank the lawmaker for taking the meeting and to tell the lawmaker why you're there. Basically, we want to talk about the medical aid in dying bill. The facilitator then introduces everyone, paying particular attention to identifying constituents, or the facilitator can turn it over and ask each participant to identify themselves. Participants will be able to share personal stories. You want to make some space for the person who's giving facts about what the bill would do to do that, and generally that is the meeting facilitator. You want to think about listening more than talking. Sometimes silence is okay. We're dealing with issues of death and dying, which can be traumatic for lawmakers who have not had to face these questions in public. And so a lot of issues are raised sometimes, and you need to give lawmakers the space to express their concerns, their fears, and sometimes their sorrow. The meeting facilitator should steer the conversation back to important points if the meeting has veered off topic. And at least one person in the meeting needs to make an ask, and we will talk about that in a moment. The facilitator generally makes sure to leave behind a packet of information, and we'll talk about that in a second as well. And then lastly, if you're meeting with the lawmaker, it's a good idea to ask who on their staff is going to be in charge of this issue so that we can get back in touch with that person to follow up. And if you can snag a business card or contact information at the end of the meeting, that would be super helpful. The next step is bringing materials. Materials that you bring on a lobby visit to leave with a lawmaker are called leave-behinds. Each team leader will get a leave-behind packet of materials for the visit, and generally speaking, what's in them is the fact sheet about the Medical Aid in Dying Act, recent newspaper columns or editorials, the poll summary, the summary of numbers of New Yorkers who support medical aid in dying, and research from Oregon or any leading medical journal, the most recent helpful information on medical aid in dying. The next step is to make an ask. Every meeting should include an ask. And on May 9th, that ask is, can we count on your support for the Medical Aid in Dying Act? The ask can be a little nuanced for each of our different kinds of people that we're meeting with. For someone who's a sponsor, it'll be thank you for sponsoring the Medical Aid in Dying Act. Will you speak with your colleagues about this? A lot of times lawmakers talking to other lawmakers is the best way to change people's minds or to suss out what the real objections are. For someone who's a supporter and not yet a sponsor, constituents are well placed to ask, will you add your name as a co-sponsor? For a lawmaker who may not be sure about his or her position, you might want to ask, will you take a look at these materials and think about it? And will you take another meeting in the future? And for a lawmaker who's an opponent, you'd think that there might not be an ask at all. I oppose, asked and answered, that's done. But there are some things you can ask. You can ask that lawmaker, will you allow others to make a decision? In other words, will you refrain from standing in the way of allowing this bill to be brought to the floor for a vote? Will you abstain from voting? Will you refrain from speaking against the bill? And will you think about it and take another meeting? The ninth step to lobbying is to say thank you. As I said earlier, ending the meeting by expressing a sincere thank you for your time, no matter what the response is the best way to go. You want to send a thank you note when you get home. Email is fine, but handwritten is actually the best. You want to get back to the legislator with specific information they've asked for or schedule a follow-up with another team or a specific person. Once you all hand in your lobby report forms, Compassion and Choices will take care of following up with anything that the lawmaker may have asked during the meeting and thanking them for the visit. The last and very important step is the report back. People hear different things in meetings, and you want to discuss what you heard with your group, but you want to do that out of earshot. So don't do it right outside of the lawmaker's office. Don't do it on the elevator. Do it when you've gotten back to the meeting point or down to the concourse, or the first floor, and talk about what you heard. Make sure your meeting facilitator or leader or someone else designated to do this fills out the lobby report form immediately so that you don't forget what you heard and you can share with us what you learned. So those are the 10 easy steps to lobbying. Let's turn our attention to how we can talk to lawmakers about aid in dying. These are the key talking points that we can use in any conversation with lawmakers or with other people in the community about medical aid in dying. These are tried and true. These resonate with many people. I'm not going to read them individually. You can take some time yourself to look them over. Go back to this point in the training and write some of them down and figure out how you might want to incorporate them into what we sometimes call an elevator speech. Or a short way of talking about why this issue is important to you. In terms of talking to legislators, one thing to remember is what not to say. You don't want to say, we don't want the government deciding, because remember, you are speaking to the government and you are actually asking them to decide whether to authorize medical aid in dying. Don't speak negatively about any particular party, conference, or member. If you're meeting with a Democrat, don't talk about the Republicans in a certain way. If you're meeting with lawmakers, don't talk about the governor in a certain way. Always be respectful. It's not your job to raise objections. Just know that if you hear one, Compassion and Choices is likely to have worked out a good answer. And if you don't know the answer, just say you'll be back in touch with the answer and let us know. If there's any question that you can't answer, just say that you'll get back to the person. Language really matters. The kinds of ways that we talk about medical aid in dying matter. I just want to make a note here about using the term death with dignity. You may have realized that in New York, we don't really talk about death with dignity. Our bill is called the Medical Aid in Dying Act, very matter of factly. And that's because we believe in this campaign that dying with dignity is really dependent on how an individual defines dignity for themselves. You don't have to use medical aid in dying to have a dignified death. People can define the terms of what dignity means to them and can die in any number of ways that constitute a dignified death. So it's important to keep that in mind. I think opponents believe that our movement thinks that the only way to die a dignified death is with medical aid in dying, and that could not be further from the truth. Dignity is really about patient autonomy and allowing patients to die the way that they see fit. I just want to make a note here so that you know the polling that was done here in New York signifies that 77% of New Yorkers right out of the box believe that mentally capable terminally ill adults should have the right to medical aid in dying. When they were given information about the safeguards and the specific provisions of the bill, and even confronted with some of the opposition's arguments, that number went up to 81%. And support for aid in dying is strong across all parties. Over 70% of those affiliated with each party support aid in dying. So there is bipartisan support that really spans all New Yorkers for this notion. So let's turn to some frequently asked questions and how to answer them. Just a note about handling hostile questions. You want to take your time before answering. Listen and assume good intent. Hostility is probably not the intent of the questioner, although it may sound that way sometimes. Make sure you remain diplomatic and stay calm. You can ask for clarification. When the questioner clarifies the question, usually the hostility is removed. The questioner will generally soften as they elaborate. You can paraphrase the question to remove inflammatory terms and ensure that you understand what's at the core of the question. And you can validate the questioner's concern. Usually hostile questions come from people who are frustrated and afraid. Dismissing an individual's concern is always a bad idea. These rules can be applied anytime you're talking to people who may have some hostility around aid in dying. Just want to make a note about the opposition. This picture will never represent our movement for medical aid in dying. On May 9th, we already know that we're likely to have opponents of medical aid in dying coming to the Capitol. Their tactics sometimes vary. But for us, I want you to keep in mind the notion of compassion. As I said, people who react in a hostile way to medical aid in dying are often acting out of fear and frustration, and sometimes because they don't know what the bill does. What I would encourage you to do on May 9th is to not engage with protesters or opponents at all. Treat everyone you meet that day, no matter what they may say to you, with kindness and compassion. We don't know each other's stories. We don't know what motivates each other to come and act the way that we do. And so I would just encourage you to maintain a certain level of decorum. Compassion and Choices New York is known for its civility and its good behavior in the Capitol. And I would just encourage you not to engage, no matter what happens. If you've got a problem, try to find a Compassion and Choices staff member and let us know what's going on. But please don't let this picture ever represent our movement. There are some ways to respond to tough questions. We're going to get to some of them, but I just want to encourage you not to be shocked at any question you get. Don't make up the answers. Don't pretend something you don't know. Don't be afraid to say, I'll get back to you with an answer. The first question we often get are, who are your opponents? And it's safe to say that the leaders of some religious groups, most notably the New York State Catholic Conference, are among our toughest opponents. The leaders of some disability rights groups, most notably the Center for Disability Rights, the group Not Dead Yet, which is affiliated with the Center for Disability Rights, and the leadership of the New York Association on Independent Living have all submitted memoranda in opposition to medical aid in dying, and some of them are likely to be there on May 9th. So those are our opponents, and we'll talk about what some of the arguments are of those opponents in a moment. But a quick follow-up to that answer may be, well, what about the doctors and the Hospice and Palliative Care Association? And this is what you can say. The majority of Americans and doctors support medical aid in dying as an option. In December 2016, Medscape did a poll of doctors that showed that 57% of doctors now support the notion of medical aid in dying, and 14% said that it depends. And it really does depend. It depends on the diagnosis and the prognosis and the safeguards. But I think the significant number here is that 29% of doctors said no, they did not approve. So that number is shrinking all the time, and support for medical aid in dying among doctors grows. There are a number of professional associations in support of medical aid in dying. You can see this list here. Many professional associations are taking a neutral position, like the California Medical Association. When CMA changed its position, it really cleared the way for California's legislature to pass the bill. And this summer, the AMA decided to re-examine its position on aid in dying. It had long had a position opposed to aid in dying, and now they're saying it's time to take a second look at the evidence and see what we now know after 20 years of experience. And finally, the Medical Society of the State of New York just voted 2 weeks ago to approve a survey about physician attitudes about aid in dying in New York. And we'll know much more next year about how doctors in this state feel specifically about the legislation. Another hard question you get is, won't this put vulnerable populations at risk? These concerns were rightly raised in the early 1990s, but evidence has shown that aid in dying doesn't put vulnerable people at risk. There's been no abuse found in the combined states' 30-plus years of experience with aid in dying laws across those states that authorize. The leading disability rights organization in Oregon, Disability Rights Oregon, has never received a complaint that a person with a disability was coerced to make use of the Death with Dignity Act in the 19 years that the law has been in effect in that state. Another objection you may hear from lawmakers is, I've heard that the bill lacks important safeguards. And the first thing you want to do is to make sure that they've seen the list of safeguards. Sometimes they're just repeating what our opponents often say in the media. So you could have a copy of the bill, or you could simply have the bill summary and encourage them to take a look at the safeguards. You should note that the safeguards included in the New York bill mirror those in Oregon's dignity law because they work. As I said, there have been no substantiated cases of coercion, fraud, or abuse. Our opponents use a number of stories time and again to point out that the Oregon law has been abused. If you hear individual cases being mentioned, the names of people who've used Oregon's Death with Dignity law associated with some abuse or coercion, we can get back to the lawmaker. We have answers for all of the examples that opponents may point to. We've done the research on each of these cases, and we know how to respond. Another thing you'll hear is, isn't aid in dying just a euphemism? So for example, if they say, isn't it just euthanasia? The answer is no, because euthanasia is when someone else is in control, not the patient. But isn't it physician-assisted suicide? Well, no, because physicians don't assist, and this is not suicide, and we'll get to that in a moment. But isn't it mercy killing? And the answer is no, because with mercy killing, which is specifically prohibited in the bill, a third party is in control, not the patient. But come on, isn't it really suicide? And the answer here is absolutely no. Suicide is when someone chooses death over life. People who want aid in dying want to live, but the illness is killing them. They want to end a painful dying process. To our supporters who are terminally ill, and to family members whose loved ones have taken advantage of aid in dying laws across the country, suicide is a hurtful term. It's used to inflame the debate. And so if someone asks you, isn't this just a euphemism to what is really suicide? You can talk about our terminally ill supporters who are full of life and who would gladly choose life over death. Another objection is, isn't this just a slippery slope? Fears that the law will be expanded to include those who are unable to give consent, those who are dissatisfied with the quality of lives, abound in the legislature. You may hear examples of laws in Europe, the Netherlands, Belgium, that have worked to really allow people who shouldn't be eligible for aid in dying to avail themselves of it. What you should know is that New York's bill is modeled after the proven law in Oregon, which has strict eligibility criteria. Every state in the US that has approved of an aid in dying bill has followed Oregon's model, not a European model. And after 2 decades of aid in dying in Oregon and now 5 other states, there has been no attempt to amend, fix, or expand the law in any of those states. Some lawmakers say, my faith prevents me from supporting this. And while it's true that faith leaders from some major religious denominations don't support authorizing aid in dying, there are plenty of other faith leaders and people of faith who do. In fact, in that same poll that I talked about earlier, 74.8% of voters who identify as Catholic support aid in dying, and even among those who attend church weekly or more than once a week, that number was still 61%. Compassion and Choices has been working hard to develop a list of faith leaders from diverse religious denominations that support an individual's right to choose medical aid in dying. And perhaps most importantly, religious freedom actually means that people and religious institutions can't impose their faith and beliefs on others who don't share them. In fact, I think California Governor Jerry Brown said it best. Jerry Brown trained as a Jesuit priest. He's a man of faith, and he takes his faith very seriously. And when the bill from the California legislature came to his desk, this is what he said when he signed it. In the end, I was left to reflect on what I would do in the face of my own death. I don't know what I would do if I were dying in prolonged and excruciating pain. I am certain, however, that it would be a comfort to be able to consider the options afforded by this bill, and I wouldn't deny that right to others. Some lawmakers say, why do we need aid in dying when we could just make sure that everyone has access to good palliative care? Or you may hear, no one has to suffer or die in pain with good palliative care. The fact is, hospice and quality palliative care relieve a tremendous amount of suffering, but not for everyone and not in all cases. 94% of all of this kind of care has to be rendered outside of the patient's home. Many people feel that dying at home is something that means a lot to them. And to receive some of this kind of care, a person can't choose to die at home. More than half of patients who receive this kind of care have multiple symptoms: pain, nausea, shortness of breath, not all of which are alleviated by even palliative sedation. And patients may be unable to communicate intelligently or meaningfully with their loved ones when medicated. But why can't people get relief from increased pain medication or palliative sedation? Well, 17% of patients don't achieve adequate pain and or symptom relief from palliative sedation. These are from reports from people who've come out of palliative sedation. The side effects of palliative care include nausea, fatigue, constipation, or on the flip side, diarrhea, grogginess, shortness of breath, constant terror. Christy O'Donnell, a supporter in California, reported no relief from the side effects of increasing doses of morphine. That's why she used all of her strength in her last few months of life to fight for California's End of Life Option Act. She said that when she took enough morphine to ease her pain, she couldn't communicate with her family. I don't want to be a living corpse, she told lawmakers in California. And finally, I would just point to the case of one of our supporters, Jay Callio, who passed away in September of this past year. Jay was in a top New York hospital receiving world-class palliative care when he died in pain and agony. He recorded a video with us prior to his death. It's available here on our website at www.compassionandchoices.org/J-Callio. In the Leave Behind packets, you'll have a postcard for lawmakers with a link to this video that tells his story and also highlights the voice of his partner, Bonnie, who witnessed his agonizing death. Another objection is, why can't people just stop eating and drinking? Well, this is certainly an option in New York. VSED, or voluntarily stopping eating and drinking, is one of the few choices that people have at the end of their lives. Some people benefit greatly from the availability of medical supervision of VSED. But in the words of one of our supporters, Stacy Gibson from the Lower Hudson Valley, speaking about her husband Sid's death, it took him 12 days to die. Can you imagine not eating or drinking for 12 days, just waiting to die? While the good people at hospice did all they could to keep him comfortable during that time, Sid developed terminal agitation, which resulted in extreme verbal and physical outbursts, making his final days horrific and frightening. It was not peaceful. It was not the death that Sid wanted. So now that we've gone over some of the tough questions about medical aid in dying, and I'm sure there are many more things that you want to know, let's just turn our attention now to May 9th in Albany and what to expect. This is our agenda for the day. At 10 o'clock in the morning, supporters will begin to arrive in Albany. I'll talk about parking in a moment, but if you're driving to Albany, just please plan in advance. If you're taking a bus, make sure that you've coordinated with Amanda Kavanaugh. If you're taking the train, make sure you buddy up with some people to take a cab to the Capitol. But try to arrive at the Capitol around 10:30 in the morning. 10:30 is when registration begins, and it will be in the New York State Legislative Office Building on the third floor above what is called the Well. And everyone that you stop in the Capitol, including the security guards, will know how to direct you to the Well. This is a marble area, and I'll show you a picture of it a little later on, so you can see, sort of get your bearings and see where to come. At 11:30, we'll be holding a press conference just outside the Senate chambers on the third floor of the Capitol building, and supporters who can walk over to the Capitol from our meeting place should be there in yellow t-shirts and signs, and help us help you arrange yourselves so that we have maximum impact in front of lawmakers and in front of the press. At 12:30, you are going to start meetings with lawmakers, and between 12:30 and 3, you're going to want to have lunch on your own. There are a number of places to eat at the Capitol. You might want to bring some snacks with you. We're going to have some granola bars and water, but you may want to bring something for yourself, because if your meetings are back to back and you get hungry, it might be hard with how crowded the Capitol is to get something good to eat. It's a challenge to get something good to eat at the Capitol anyway. So think about that when you're packing for the day. The meetings will mostly be in the Legislative Office Building. Some may be in the Capitol, and some may not be in an office at all, but you may be calling a lawmaker off the floor, and your meeting leader will teach you how to do this. Basically, they'll be putting their card in to the sergeant at arms outside of one of the chambers, and you'll be meeting with the lawmaker in a hallway. So depending on what time lawmakers go into legislative session, the meetings will either be in their offices or outside of the chambers. You're going to receive your own schedule probably the night before, but definitely when you arrive to register that day. So please be patient with us. Lawmakers take a lot of cajoling sometimes to get them to respond. So we are still in the process of scheduling those meetings. At 3:30, if you can, make your way back to the Legislative Office Building for a send-off gathering. I would encourage those of you who are meeting leaders or who want to fill out the evaluation of our lobby day and report backs from meetings, please come back to the Legislative Office Building and turn in those sheets. We also want to save money in this campaign, so if you can return your name badge also so that we can recycle it and use it next year, that would be helpful. And then we hope to have you on the road by 4 o'clock. If you have transportation needs, please contact Amanda Kavanaugh. We can't help you get to Albany unless we know that you need help in getting to Albany. We're going to be doing lots of social media and multimedia on May 9th. We're going to be doing photographing, live streaming the press conference. We'll be active on Facebook and Twitter. You'll have a how-to Twitter sheet with Twitter handles for lawmakers you should tweet to. So if you are one who tweets, get your Twitter account up and running by the time May 9th comes around, and we ask you to use the hashtag #AidInDying and tweet at us at Comp and Choices NY. That's our Twitter handle. If you have a smartphone, please take pictures throughout the day to send to Compassion and Choices New York on Facebook. Post yourself and tag us, tweet, or you can send them to us afterwards. We are not employing a professional photographer that day, and we can't be everywhere. So if you want to take a picture with lawmakers after the meeting, a lot of times lawmakers are happy to stand with you and pose for a picture. Ask one of their staff members to take the picture with your phone and send those pictures to us so that we can put them up in a big, happy compilation at the end of the day. So, parking. Parking is not a pretty picture. It is difficult to park in Albany, and I cannot stress this enough. There is a website that lists all of the parking garages in Albany, and you should visit it if you plan on driving. It is very likely that the visitor parking lot at the Capitol will not be open that day. So do not count on parking under the concourse. If you have a mobility issue and you absolutely have to, please get in touch with Amanda or I, and we can try to arrange something. But parking is a headache. It's not fun. Please plan ahead. Consider carpooling. Prepare to walk or have a driver let you out at the entrance to the Legislative Office Building, which looks like this. Please be in touch with Amanda if you have particular questions ahead of time. We will not be able to answer questions about parking on lobby day. So if you give us a call, even though we always encourage you to call us, we will probably not be able to answer any questions about parking on lobby day. This is the security. These guys are super nice. You just want to make sure that you're mindful of the fact that you're going through security, and dress and plan accordingly. You can bring food and drink through, but metal objects will set the metal detectors off. That you can see right outside of the Capitol, right outside of security is the sign for the Capitol, and then to your left of this picture is the sign for the Legislative Office Building right there. So that's where you're going to head for registration and the opening. You're going to head towards the east elevators, and you see those marble steps right there? You either walk up those marble steps or you take the elevator to the 3rd floor. And we are going to be in this area. We're not going to look nearly this somber, but this is the meeting area that we're going to be in on lobby day. It is the landing right above the well in the Legislative Office Building, the marble area. You will not be able to miss us. There will be signs, but these are some clues about how to get there. Look for Sheila. Sheila Sable is our lobby day coordinator. If you see her, you know you're in the right place. If you see a lot of yellow t-shirts, you're probably in the right place. After our gathering, you're going to head to the Capitol for our press conference. This is the entrance to the corridor that leads between the Legislative Office Building and the Capitol. You are going to either take the elevator or the escalator. Basically, take the elevator to the third floor. That is the elevator. And you're going to be meeting with us right outside of the Senate chambers for the press conference. These are the steps adjacent to the meeting spot for the press conference. It will be much more crowded than this on May 9th. Here are some places to eat. There's a Dunkin' Donuts inside of security in the Capitol. There's an Au Bon Pain outside of security on the concourse. There's Prime at the Plaza, which has a lot of different options for eating, vegetarian, salad, waters. That's right outside of security on the concourse. There's also Taste of the Plaza, which is much further away and quite honestly not probably worth the walk, although there is an organic food stand there from Honest Weight Food Co-op. So if you had the time, you could walk all the way down the concourse to that. There's also this express stop. This is in the Capitol, close to the Dunkin' Donuts. For those of you in New York, from New York City. This is the closest thing to a bodega you'll probably find, and it has a lot of sundried items that you might need during the day, and that is within security. So that is it for what to expect in Albany on May 9th. You may still have some questions that I haven't gone over, and I encourage you to certainly get in touch with us. Afterwards, you can reply to the email that you got this webinar from, but I'm sure you have contact information for me, Corinne, Carey, the campaign director, or Amanda Kavanaugh, our outreach manager. For those of you who are curious about leading a meeting, we're going to go over tips for meeting leaders in the next few moments. If you've been to one of our lobby days before, we may tap you and ask you to be a meeting leader. There are so many meetings this time because we're scheduling all of these meetings around you and your own lawmakers that there could possibly be a meeting where you don't have a leader. We're working hard to make that not be the case. But if you're interested in being a meeting leader or you just want to know what the role entails, here are 10 quick tips. If you want to volunteer, make sure you get in touch with Amanda. Your main job is to make sure that you get to each appointment you have on time. No matter who else shows up, you are the main representative at this meeting. The first thing that you do is you introduce yourself to the receptionist or the staff member and you tell them that you're here for Compassion and Choices meeting. The office will not have your name. Amanda Kavanaugh organized each visit, so they may have her name or they may just simply have Compassion and Choices. Staff should know that Amanda Kavanaugh herself will not be at these meetings. Well, she'll be at her own meetings, but she won't probably be at your meeting, and that is normal. So just introduce yourself and tell them that you're here for the Compassion and Choices Lobby Day. The first thing you want to do when you get into the meeting is thank the lawmaker and his or her staff for taking the meeting. Tell them that you're here to talk about the Medical Aid and Dying Act, and have other participants in the meeting introduce themselves. Ask constituents to identify themselves. If you don't know who among your group is a constituent, you can ask them outside the office before going in, or you can simply ask them to identify themselves during the meeting. If you know you have a storyteller in your group, ask them to tell their story, or participants to tell the lawmaker why this is important to them. Direct the person that you're meeting with to the one-page fact sheet on the bill in your packet and let them know that there's a whole host of other information in there. You can use this to tell them a little bit more about the legislation. If the conversation gets off track and participants start talking about other issues like bridges and infrastructure or daycare funding, just make sure that you politely redirect the conversation if it gets off track. Before you leave, make sure to give the lawmaker the packet of materials, quote unquote, the leave behind. You want to make sure that the meeting contains an ask. You want to ask the lawmaker if we can count on their support for the bill. If they're supportive, please ask them to sign on as a co-sponsor. If they're not yet supported or they're undecided, ask the lawmaker if they have any questions or concerns about the bill and listen carefully. Remember, you don't have to answer every question, and the most important part of these visits is the report back so that we know how to follow up with each lawmaker, what they need to hear, and who they need to hear it from next. This will not be the last meeting that we have with this lawmaker. The most important part of the meeting is the report back. Please fill out the lobby report form in your packet and return it to Compassion and Choices staff member or a volunteer. Folks, that is it. That is everything I think you need to know to have a successful and enjoyable lobby day on May 9th in Albany. If you need more information, please don't hesitate to contact me by phone or by sending me an email, or you can always respond to Amanda Kavanaugh. I look forward to seeing you in Albany on May 9th. And until then, take care.